that we're discussing universal health care today. It's been 15 years since Congress last seriously discussed reforming our broken health care system. In that time, the system has become more expensive, covers a smaller fraction of Americans, and is in greater need of reform. As a U.S. representative and as the husband of a primary care physician, I've heard many stories about hardworking New Jerseyans who cannot afford the medical care they need, do not get the preventive care they should have, and feel that they're just one illness or one accident away from bankruptcy. Recently, I brought some Central New Jersey primary care and patient advocates to Washington to hear from them their experiences of frontline health care and to meet with leaders of health reform. A pediatrician shared her story that primary care providers like her are struggling to see more patients while receiving lower payments from insurance companies for the primary care services. I was troubled hearing that because children who are not kept healthy tend to become unhealthy throughout their lives. I heard similar stories at a health roundtable I hosted this Monday at a community health center in Trenton, New Jersey. A spouse of a cancer patient told me that when she and her husband came home from the hospital, they returned to stacks of insurance paperwork. Even after completing these forms, the family still had $150,000 of out-of-pocket costs for the medical care needed to battle her husband's disease. We must reform the system and keep patients and families like hers secure so that they can worry about getting well instead of worrying about insurance paperwork. I've discovered such stories are widespread. In 2009, healthcare spending throughout the United States will reach more than $8,000 per person. This should be more than sufficient to provide excellent care for everyone, and yet 46 million Americans lack insurance and many millions more have coverage that doesn't meet their needs. While we spend almost twice as much per person as other countries with advanced medicine, America has the highest number of medically preventable deaths of 19 major countries and higher infant mortality than others such as Japan and Germany and Great Britain. Without health reform, business costs will continue to increase, family out-of-pocket costs will rise, and American workers won't receive the health care they need. Health care reform should not be about economic theories and obscure accounting techniques. It should be about making Americans healthy, giving American families security and knowing that they have affordable health care. I expect to vote for America's Affordable Health Choice Act, which would assure quality coverage for all Americans, improve the quality of care, expand preventive care, and lower the health care costs that Americans pay. This reform proposal will build on our existing system. So if people are happy with the insurance they have, they can keep it. It's a good basis to build on. It's not ideal, and this is not the health legislation that I would have designed from square one. But I do want to highlight two features of the bill, creating a public health insurance plan and ensuring and increasing resources devoted to primary care. A public health insurance plan needs to be included in any legislation to lower costs and improve health care delivery. In addition to increasing competition, a public plan would provide a way to inject innovative strategies and deliver higher quality and lower cost health care, such as encouraging integrated medical care and increasing primary care. As this bill goes through the legislative process, we must make more improvements to this public plan, and I'm working to make those improvements. Primary care also must be a focus of health reform. Primary care providers, including doctors, advanced practice nurses, physician assistants, are in the front line of health care and have the ability to integrate a patient's care. I'm pleased the legislation includes several proposals to improve primary care by increasing the primary care workforce and enlarging community health centers. I look forward to working with my committee colleagues to improve this bill further. I'm pleased to support an amendment creating a small employer benefit, which would provide a new way for affiliated small businesses to join together to offer health insurance and other benefits to employees. I'm pleased to work to advance this project with Representative Hare, who has championed this proposal to help small businesses, and with Representative Andrews, who has advocated this concept for several years. I'm also pleased to work with Representative Polis to introduce an amendment that would provide additional job training in order to expand the healthcare workforce. The amendment would establish a grant program to increase the number of online health workforce training programs and start a clearinghouse that would collect and disseminate best practices for online job training and provide technical assistance to those programs. We can no longer accept the status quo under which Americans will continue to pay more, live sicker, and die younger. This year, we will reform our broken healthcare system. I know it won't be easy. We've tried since Teddy Roosevelt was president. Congress has tried again and again to pass universal health reform. However, with current presidential leadership, a supportive Congress, the leadership of Chairman Miller and others here, an American public that now understands what's at stake, I think the table is set for historic reform. As primary care providers and patients from central New Jersey have told me, we must fix our health care system to keep individuals healthy, to prevent diseases, and to provide health security for all Americans.